This conference will now be recorded.
Welcome to our final call for 2019 of the Oral Health Kansas Friday Noon calls. My name is Christy Nance, and I am the Policy Director here at Oral Health Kansas. These Friday Noon calls were really developed to provide legislative updates, opportunity for education, as well as a chance to answer some of the questions that you guys might have. And we do it every other week throughout legislative session. So this is our final call for 2019, like I said. Thank you for joining us today. So this call will really be focused on the final days of session, what happened, and then what next steps are. So the legislature returned on May 1st from April adjournment, and they took about the whole month of April off and returned in May to finalize and pass the budget bill so that they could end session for 2019. Medicaid expansion has been a hot topic during the 2019 legislative session. So it was only it only made sense for it to come up in the last few days of session. So Medicaid expansion had passed the House in March, and just a quick recap in case you weren't on that call, it passed through a gut and go type of bill. So they used a bill that had passed through the Health Committee and had made it to the House floor, and they took that bill that had nothing to do with Medicaid expansion. It was focused on nurse practitioners, and they gutted the entire bill and included language that would expand Medicaid, and it passed. And so they had to do that gut and go procedure because the leadership has been so resistant to bringing Medicaid expansion to the floor in both the House and the Senate. So the House used this as a way to make sure that Medicaid expansion passed through their third chamber. So it passed through the House, and it was awaiting its time on the Senate floor. It didn't pass. It didn't reach the Senate floor. March didn't reach it all in April, and then we didn't see it in the first couple days when they returned in May. And that's really because the Senate leadership was just preventing this bill from reaching the floor. So the House decided that the last thing that they needed to do during 2019 legislative session was to get this budget bill passed. Well, they decided that they were going to use the budget bill as leverage by rejecting the bill, hoping to force the Senate to vote on Medicaid expansion. So using some political maneuvers to make sure that Medicaid expansion ended up on the Senate floor. So they rejected the budget bill quite a few times. I think it was 2 or 3. And so each time it went back to the conference committee and then bounced back to the House. But unfortunately, the Senate just, wasn't spooked by the rejected budget bills, and they continued to refuse to vote on Medicaid expansion. So ultimately, the House ended up approving the budget and ending the 2019 legislative session early Sunday morning, May 5th. So unfortunately, that means that Medicaid expansion did not pass for 2019. The Senate did agree to hold a study on Medicaid expansion this summer. That was kind of a big reason the leadership didn't want to see Medicaid expansion on the floor, because they felt that they needed to further study how it would impact Kansas. So they are going to have an interim committee hold a study session on Medicaid expansion this summer, and that committee will consist of bipartisan House and Senate members. And hopefully we'll see a Medicaid expansion bill in 2020, and hopefully it's of good quality and has all the aspects that Oral Health Kansas and the rest of the state can get behind and support. So the exciting news is the budget bill did pass, and the final budget included an increase for dental reimbursement rates. The exact language that was in the bill was $3 million, which included $1.3 million from the state general fund for Medicaid dental reimbursement rates. And just real quick for those who don't understand budget talk, something that I've learned this year, the $1.3 million from the state general fund is what our state will put towards those reimbursement rates, and then the rest of that funding comes from federal Medicaid match dollars. So there will be $3 million new dollars dedicated to oral health in our state in 2020. So we're just really excited that the legislature was supportive of oral health this year. And I know I've said that said that on many calls before, but just really thankful to the legislature for their support this year. We are working with the Kansas Dental Association and the Kansas Department of Health and Environment Division of Healthcare Finance to get this increase implemented. We wanted to make sure that we were there to kind of help decide what procedures this increase went to so that we can make sure that that $3 million is used as efficiently as possible. It will most likely focus on higher utilized procedure codes, as well as codes that the Kansas Dental Association members feel could impact their involvement in the dental provider network. One of the big reasons that we really worked on increasing reimbursement rates this year was to help increase the number of dental providers that are providing care to our Medicaid population. And so we want to make sure that we're targeting those codes that Medicaid beneficiaries are more likely to use, as well as ones that will help entice additional providers to join the dental provider network. So we are working closely with the KDA and KDHE to get that implemented. We're expecting implementation to begin either August or September 2019, a little delayed just because of how late the budget bill got passed through. So we are also going to be tracking the Medicaid dental provider network just to see if there is an increase in the number of dental providers following the rate increase. So we have data from January 2019, and then we will reassess the provider network a few months after the implementation takes effect. And we're really using that to kind of have data to go back to the legislators and say, you know, this increase in funds did work, or hey, maybe we need a little bit more money dedicated to this to really see an impact on our dental provider network. We also will be tracking utilization, because another end goal is that if we can increase the number of dental providers providing care to Medicaid beneficiaries, we can increase access to care. And so hopefully Medicaid beneficiaries will have a dentist in their community that they can go to and really help increase the utilization of their dental benefits. The next steps for the legislature as a whole, they will return on May 29th for their last bit of session, where they will consider any bills that Governor Kelly vetoed to decide if they want to try and override her vetoes. Over summer, the interim committees will meet as necessary, such as the Medicaid expansion interim committee that I talked about, and then the CanCare Oversight Committee will also be meeting, which is the committee that oversees our Medicaid program. That is one that we, Oral Health Kansas, testify at quite a bit. And then the 2020 session will begin in January, along with our Oral Health Kansas policy update calls. So following May 29th, the 2019 legislative session will be officially over, and they will take the summer off and prepare for 2020. So that is all I had today. A fairly short call, but I wanted to make sure that I wrapped up the legislative session with all of you guys. Are there any questions about legislative session, or maybe what the summer is looking like? Anything that I talked about today? You can either unmute yourself, or you can put your question in the chat box. All right. Well, I have a question for you guys. With this being our last call, I want to make sure that these calls are beneficial to you. And so we're always looking for ways to improve, new resources. And so I just want to kind of leave some space for if you guys have any feedback for us on how we could be making these calls better. Is there a different time that would work better for you? Any feedback we would greatly appreciate. And if you happen to be listening to this recording on our website, you can always email us. I will put our emails at the end if you have feedback and have just been following along via our recordings. So I'll leave some space now if you guys have any feedback on these calls, or if you've just been enjoying them, that is okay as well. All right. Well, I thank you all for joining today and for joining along, following us throughout session. And I hope these calls were helpful to you. I hope you guys all have a wonderful summer. Thanks for joining.